Hey YouTube, it's Marita. Welcome to another edition of the Nurse Lounge. And in this edition, we're going to talk about what it is like to take care of a forensic patient. So if you want to know what it's like, then definitely stay tuned. We are back. My name is Dr. Marita P. I am a registered nurse. I've been a nurse for about 16 years now. I am an OB/GYN, well baby nursery nurse, and I am a nurse educator. I am a nurse mentor and a nurse consultant, as well as nurse blogger. So in this video, we're going to talk about basically what it's like to take care of a forensic patient. So do you all know what forensic patients even mean? So a forensic patient is basically a patient who was a prison patient or a jail patient or whatever. So guess what? They get pregnant too. Or maybe they have committed a crime and they, believe it or not, they're already either pregnant already, or sometimes, guess what? Sometimes they get pregnant inside the jail. That's another whole story for another day, but that's none of my business though. And that's not even what this video is about. The point is they're pregnant, and the point is the baby's coming out, right? So I just kind of want to talk to you about what it's like to care for a forensic patient. And again, I've been doing this for 16 years. I've had various forensic patients, or whatever we call them, forensic patients, in my care. And, you know, honestly, when it comes to my care for them, I used to be very scared to care for them because I'm like, oh, what did they do? What did they do? What did they do? And now I really don't even care what they did. I mean, I want to know because I want to know if they were violent, that I need to protect myself or be more mindful. But for the most part, I don't even care what they did. I'm just there to take care of my patient. And because I am a patient advocate, I'm going to take care of my patient no matter if you've killed somebody, no matter what you've done. I'm going to take care of you. Now, when it comes to a forensic patient, they have guards with them at all time, typically 2 guards at all time. And the guards do have their weapons, okay? The guards may not be female. They can have a male and a female, 2 men or 2 women. It just depends on who's working that day. Typically, they switch out every, some places every 12, some places every 8. So during your 12-hour shift, you could see the guard switch out 2 or 3 different times. What I have learned though is when it comes to the guards, what they allow their inmate to do is based on the guard. So there's been times where I'm like, okay, this guard will let them watch TV, where the next guard won't let them watch TV, and they follow the, you know, the rules to the book. So I've learned that over time, I just have to simply ask a question. Okay, what can he or she, well, not he, what can she do? What can she not do? So a typical patient, when it comes to having a baby in labor and delivery, for the most part, they are shackled to that bed via the ankle. Their ankle is shackled to the bed. And some places even do the wrist and the ankle. And I've seen them at some hospitals where they are shackled to the bed even while delivering the baby. You may think that's barbaric. Where's she gonna go? Where's she gonna run off to having a baby? Hey, I can't even tell you, but I'm simply saying that I've seen that happen, where even physicians have said, hey, can you please take this shackle off? We're trying to deliver a baby here. Now, I don't do labor and delivery, but I have had, you know, seen that happen. If anybody is a labor and delivery nurse and you've had a forensic patient, comment below, you know, what they do at your facility regarding the shackles on the ankle for delivery. But when it comes to postpartum, our patients are shackled to the bed. Typically only the ankle is shackled. One ankle is shackled to the bed. So you will see that. And honestly, you have to go assess that area when you do your assessment to make sure that shackle is not creating any circulation issues or things like that. When it comes to your assessments, you do your assessments no different than you do with any other postpartum patient. However, if you have male guards, I have told them that they need to either turn their back or they could step on the other side of the curtain, but they were not allowed to be there to watch me do the assessment. At our facility, that's okay, but at your facility, you may have to do whatever your policies say to do. It could vary per facility. So when it comes to the assessment, like I said, I basically just do my head to toe assessment per normal. She is shackled to the bed. Usually well, it just depends on how the layout of the room is, but usually my patient's right ankle is shackled. No, I've seen both. I've seen either or, right or left ankle shackled to the bed. And again, you do have to check for circulation, make sure there's not causing any indentation in their legs. Keep in mind that when it comes to postpartum, it's not uncommon for mom's legs to swell. So you do want to check those shackles quite often throughout your shift to make sure that there is nothing going on with that. You also want to let the guard know what you're doing. When it comes to the guards, you do need to be you need to communicate very well with the guard about what you're doing, what's going on, things like that, because it just depends on who's working, how anal they are. Okay. Now, many people, I've had situations where people ask me, well, does the mom get to see her baby or hold her baby while she is in jail, not in jail, but in the care of your care at the hospital? And honestly, it just depends. So it depends on what their offense is. If they did something violent, they typically do not get to bond with their baby or hold their babies at all. The baby is going to be taken away immediately after birth. They typically don't get to bond, any of that, if they did something violent. If they did not do something violent, then typically, depending on your policy. Now, I'm not saying this is true for every hospital. I'm saying this is what's going on at our facility. So don't think this is how it is everywhere. You would have to ask what your hospital does in these situations. But at our facility, we do allow those moms who did not do something violent to bond with their baby. They hold their baby. They typically they don't breastfeed their babies, but they do get to hold and bottle feed and basically take care of the baby while they're there. I take that back. I don't know if they can breastfeed or not. I don't know if they can breastfeed or not because they're going back to jail. So I don't know what happens in that situation. Typically in those situations, though, a family member does take the baby over, and that's how that works. So I don't think they breastfeed. I don't think they do breastfeed. I don't recall ever seeing one breastfeed, but I honestly don't know. So anyway, like I was saying, some of them get to care for their baby, some of them don't. In terms of what the room layout happens to be, there are no phones in these rooms. Most of them cannot watch TV. Most of them, or not most of them, all of them cannot have any utensils like your normal silverware. They have their own like specialty, they use styrofoam for hours. So styrofoam cups, styrofoam trays, styrofoam plates, and then like your cutlery that you buy like when you having a picnic or whatever. They use that kind of stuff. You can't have anything like normal. Also, what I just learned, that at our facility, they cannot pick, like our patients pick their food. They can't pick their food. They get what's called house special, is what I was told. So house special is whatever they done threw together in the kitchen. That's what they get. They don't get to pick anything. So basically the same provisions or issues, or not issues, but the same policies and rules they have in place for them in the prison or in jail apply on the hospital setting. They cannot have anything that is considered to be a treat. So I got yelled at one time by an officer, by a guard, because I had gave my patient a Sprite, my forensic patient a Sprite. Again, not thinking anything of it at all because of the fact that everybody on our floor gets Sprites. So I gave the patient a Sprite and they were like, is this medically necessary? I'm like, yeah, because she need to be hydrated. And so she need to drink some water and some Sprite and things like that. She can drink only water. She can't have no Sprite because that's considered to be a treat. I'm like, oh, okay. So that lady had already drunk that first Sprite. I just knew that I couldn't give her any more Sprites because the previous guard did not mind, which is my point. They are not always consistent on how they do things. So the previous guard didn't say nothing to me about the Sprite, but this next one did. So they can't have Sprites or can't have anything like that. There was this one time I had a C-section mom who was a forensic patient, and she was able to have Sprites because she was on a clear liquid diet. So again, I'm still learning how this works. Because she was on a clear liquid diet, she could have Sprites because that's what she could have on a clear liquid diet. But once she got to a regular diet, she could no longer have Sprites because that's considered to be a treat. Otherwise, it was considered to be medical treatment. So if it's something that is used as medical treatment, they can have, but if it's something that is a treat, they can't have. In that same situation with that particular patient, I asked the guard if she could watch TV. And these guards, I guess, wanted to watch TV themselves. So they were like, is it medically necessary? And I'm like, yeah. I said, she needs to watch the TV because I'm going to have her do her incentive spirometer. And every time it goes on commercial, she needs to do an incentive spirometer. So, you know, the rule on the IS or incentive spirometer is you do about 10 times an hour while awake or something like that. You don't know anybody going to do that. So what I tell my patients is when it comes to the incentive spirometer, when the TV goes to commercial, do the incentive spirometer while it's on commercial. So about 30 seconds or so. And then after that, you can stop for 15 minutes. About every 15 minutes or so, the show will go to commercial, right? And that way they may not do it 10 times an hour, but at least they're doing it compared to not doing it at all. So the guard was like, oh, okay. So since it's medically necessary so that she can keep up with her regimen, he got it after a while, that she could watch TV. But I guarantee you that's because he was flexible. Then the next guard was like, no, she can't watch any TV. So I'm like, okay, you know. So we knew to move how the guards wanted us to move. So in general, that is kind of how it's like to have a forensic patient. Now, I will say this. When it's time to go back to the prison or jail, these people can act a complete donkey on you when it comes to that. They are, I wouldn't say happy, but they are definitely happy to be out of the jail environment. So therefore, they are a lot more, usually more personable. They are, I'm not afraid of these people. They are just regular women, just like you and I are, if you happen to be a woman, who have done something they shouldn't have done and got caught doing it. Basically, is what happens to them. I am not one to judge people for stuff like that. So therefore, I'm kind of like, okay, I'm gonna do my job and do my job very, very well. And so I treat all my patients the same. I don't care what your situation is. I treat you the same. But when it's time for them to go home, I keep saying go home. When it's time for them to go back to jail, when I tell you they threw all kinds of fits, not all of them, but the ones I've seen, especially at the county hospital, they throw all kinds of fits, and all of a sudden this is hurting and that's hurting and this is going on. Oh, I can't walk. They throwing anything to stay longer at that as a patient. But of course, like I said, you can't, if you're discharged, it's time for you to go, it's time for you to go. If you consider to be medically OB wise fine, there's nothing we can do to keep you there. So it's very difficult to watch that when you see someone go from they don't want to leave and they act a complete donkey to all of a sudden things are hurting and things that was not hurting. So I've seen all that before. I actually have not had a combative, in my 16 years, I have not had a combative forensic patient at all. I'm very fortunate in that situation. I'm happy about that. I actually like taking care of them. Now, you ain't gonna catch me inside no jail working as a nurse. I will not do forensics in the jail population. I won't work over there, but I have no problem when they come to the hospital because for one, they have 2 guards with them at all times. And they can be manipulative, but you know, that's how those people are anyway. But you know, you can't pull much on me. I'm like, okay, whatever. But again, taking care of that population is very interesting. It's very different. You do find out some stories about their lives. Sometimes they get to talking and they done told you everything done happened, what they done did. My last forensic patient I had, it was the domestic violence situation, but she beat up the boyfriend or whatever. And that's why, and she ended up in jail. So you know, with domestic violence, when you abuse someone, somebody going to jail. Well, it ended up being her because she ended up beating up the guy. So I'm like, okay, I ain't mad. I mean, if he here trying to put his hands on you, I ain't mad at you for defending yourself, you know. So it is what it is. But that's why she was there. So because of the nature of the situation, it was considered to be violent because it was her defending herself as to why she got to have her baby and not typically the other way around. So anyway, that's pretty much what it's like caring for them. I told you they can't have any phones, no TV for the most part, no special drinks or any snacks. They have house special food. And I told you about, you know, them being shackled to the bed. When it comes to bathing them, so like they'll take a shower. They typically will have usually a female guard there, and she will shower with them. They make sure that they get showered type of thing. At least that's been my experience. So I don't know if that's different somewhere else, but they will allow them to shower, but then they will shackle them back to the bed type of thing. I will just sit there and observe to make sure she got to the shower so I can document that, okay, the guard took over with the ADLs after that. But for the most part, I just basically watch for her gait and make sure that she's doing good in terms of getting to the shower. I do come back and follow up and make sure that she's still good when she comes back to the bed. And I do continue to do circulatory checks on that shackled leg just to make sure it's okay. And some places, depending on the situation, they will shackle both the wrist and the ankle. So if that's the case, you need to make sure that you are checking for circulation warmth, everything that you need to check for both areas or anywhere there's a shackle in place. So it's, for me, it's not unnerving, but if it's your first time seeing someone shackled to a bed, it will be kind of unnerving for you. You're going to be like, oh my gosh, I can't believe that this patient's shackled to the bed, and you're kind of, you know, taken back by it. But for me, I'm so used to it. It's not too much I haven't seen at this point in time that it really scares or frightens me or things like that. The only time I've been frightened here recently is when I had a schizophrenic patient who was psychotic at the time. That scared me, but outside of that, I'm not really scared. So anyway, that is all for this video. Please comment below if you've ever had a forensic patient. And this is for anybody who does any kind of nursing, because you could have forensic patients in med-surg, in OB, in obviously the ER is where they come in through. ICU, you know, we have a hospital here in the Nashville area who has a forensic floor. So if they're not OB, if they're OB, they come to the OB floor. But if they're just there for some type of illness, male or female, that's not related to babies, they have a whole forensic floor that's locked down at this other hospital. And so I did clinicals at that hospital, and I've always wanted to see what that floor was like. But your badge will not let you off on that floor. You have to have a special badge to get off on. Anyway, I've always been intrigued. You know, I've heard stories about what it's like to be on that floor, or that they have, you know, I'm sure they have guards all the way around, and they all have weapons, which that's how it is with on our OB floor. But, you know, comment below what it's like for you to have a forensic patient in your specialty that you work in. I'm sure it's very different. I'm sure there's some fundamental things that's the same, but do they act a fool? Do they intimidate you all? Do they manipulate you? Do they come up with stories as to why they need to stay when it's time for them to leave, like they do in OB? I'm sure we have some similarities. So thank you so much for watching this video. I need you to comment, like, subscribe, and share this video. This is a very different video. I haven't seen anything like this on YouTube before. Not saying it's not there, I just haven't seen anything like it. I am a different kind of YouTuber when it comes to my nursing and my nursing content. I'm not going to put anybody else down, but I like to discuss the real issues with nursing, the good, the bad, and the ugly, and I present them exactly as they are. If things were that bad with nursing for me, I wouldn't be a nurse anymore. I still love what I do as a nurse, but I'm just transitioning out of bedside into academia full time, and I'm excited about that transition. So definitely, let's have some dialogue in the comments about what your experiences are when it comes to that patient population and how it works and how real it is for you. So if you want to follow, no, not if you want to, you need to be following me on IG. My IG is going to be listed somewhere on this screen. It's in the banner at the top, as well as the description box below. Thank you so much for watching this video. And until the next time, you all take care. Bye-bye.